Here see, you can see the sterilized probe, mirror, tweezers, scissors and everything. I don't think so. You might have seen this kind of picture anywhere in the clinic. Did you see that? See, all assistants they are standing. Nobody is touching the instrument. The surgeons they are working the mouth. And the complete room is fumigated, and this kind of oral surgery is going on. You see somewhere, I don't tell you to go to this kind of clinics, but you should know what is an ideal clinical atmosphere has to be there. So you get an idea, the basic idea about it, where I have to go. If, see here again, if you want to go these kinds of clinics, very nice. And these photographs are being taken by me. I went as a patient. I took the photographs of certain clinics because I am at the state level of the Indian Dental Association, at the central level of the Indian Dental Association. But there are certain rules and regulations. Due to that, we just cannot remove these kind of people from the society because everything is going hand by hand. No problem. But you people has to be aware of this, and I'm making you aware. Don't go where, see, all the instruments are infected, they are not sterile, they are used multiple times in the multiple mouths. So be aware of this. And what happens? What happens due to this? Who is responsible for this? Doctor? Patient? Assistant? No. We are responsible for this. Because we don't bother about our child life. We take our child to this kind of dental surgeons because they are charging you 50 rupees. And though he is a surgeon or not, he was a quack, whatever he may be, he is putting up the dirty instrument in your child's mouth, and he has used the same instrument in the previous patient who was suffering from the corona. And these swelling cases are very hard to treat. Nobody will come and teach you. Nobody will come and take your treatment. Let me tell you, if you bother about the life of your child, not your child, but all the child's. Because you are the teachers, you are the backbone of the society. So I said, why my teachers are the backbone of the society? Because you have a responsible hands. And you can guide the people. Now, as Dr. Sir told me, Varani Sir, the NAC has made you compulsory. So I think so in future also, you will have to tolerate me sometimes, like today. Yes, sir. Now, yes, this kind of cases, see, can you see this case? We'll have to cut from outside because patient is unable to open the mouth. मुंह खोलो. अभी डॉक्टर कहाँ से हाथ डालेगा अंदर? प्रोब मिरर किधर से डालेगा? Then there is no any other alternative. We'll have to cut from outside. You have to cut from outside and think about your beautiful face. If it is being cut somewhere here, how it will look. So what you have to do? What I'm telling you, you should have the basic knowledge of all the branches. You should have the basic knowledge of the which clinic to go. And you should have courage to ask any kind of question to the doctor. And if doctor is not answering you properly, he is not giving the proper response, talk to the association of that particular area. Everybody has got the state association, a local area association, you can say the central association, UMA, NIMA, IDA, everything is there. These are the cases to be admitted. These were my case, all are my cases. I operated, I operated this case. There was a young man of the impacted molar, and moreover, you get this kind of condition only with your last wisdom tooth, because there is a less space that tooth to come out, and your upper tooth, lower tooth, and in between the soft tissue is getting beaten up. and that area, soft tissue, is getting infected, and it becomes very difficult for you to open the mouth. Then again food lodgement is there, and in that somebody comes in nearby, na, people they come there, अरे गरम से सेक कर, गरम से सेक कर, अच्छा हो जाएगा. And in that, if you shake it with the hot, it flares up the condition very bad. So whenever you are getting dental pain, you should not suggest anybody to have a hot water fermentation. You should tell them to have the ice cold fermentation. Okay, I know that you are getting any pain. You tell there, you can have hot water fermentation. Overhead, it's okay, because there is no infection there inside. There is swelling. You know why you apply hot water? Why do you apply hot water? हम facial करते हैं ना, to increase the more blood supply of the face, to increase the more blood supply of that particular area. But you know that if the more blood supply is increased to that area, if the blood supply is going there, it is coming back also. Is it? And from the infected area, when the blood goes there, it comes along with the infection. And it spreads everywhere. So this kind of situation arises. Can you see this condition? This is a very bad condition. You have to admit this patient and you have to see this patient 8-hourly. You have to inject with IV. And you have to, this patient has to be under the observation of sister or staff. Otherwise what happens, There are the patients, they went in the kidney failure, because this is the pus formation, and this complete pus formation, if it is not being removed, it will circulate to the kidney, and all the white blood cells will choke up your kidney. And you mean to say dental treatment is a very simple treatment? Dental pain is a very simple pain. There are the patients I have seen dying along with, and people say, I say poison ho gaya, blood poison ho gaya. This is the blood poison. This is the complete white blood cells becoming the pus cell, dead cells, and they are being filtered through the kidney, and all the nephrons of kidney are being blocked, which is very, very difficult to remove. And the patients, they are going for the dialysis. And who can tell you this? Sir can take a 10 times better lecture, because previously the first lecture might not be that much impressive, but then the people, they ask me, doctor, why this, what is this, why this, what is this? And that lecture is being improved due to these questions. Always you do the better job by telling all the kids, show them the pictures, tell them, hey, see how she is doing the brushing, you also do the brushing. Sometimes the child, they feel that paste is very sweet, and nothing happens. Don't worry about it, because all the product is being tested to make them habit. And among you, all of you, please tell me how many you do the brushing before going to the bed. Among 100, hardly 15. You know what you are doing? The people, those who are not doing the brushing before going to the bed, what you are doing, आप लोग खाना बनाते हैं, खाना सुबह सुबह बनाते हैं, डब्बा पैक करते हैं, अगर दोपहर में नहीं खोला तो शाम में क्या होता है? It smells. Hardly eat everything, and during night time, 12 hours, you subote. You should always do brushing before going to the bed. If you are not doing in the morning, no problem. You know that? Why? Because I am talking. And the bacterial count of our oral cavity, anaerobic bacteria, two types are there, is it? The bacteria, those which are present in your mouth, they cannot live in presence of oxygen. So they are automatically getting finished. They die. And if it is closed, no air is there, bacterial count increases. So I will not tell you, don't do the brushing in the morning, do in the morning as well as in the before going to bed also. Got my point? I gave a very simple example of the tiffin, what you make it in the morning and open it after 12 hours, it will smell. So same thing, same condition is of your mouth, and the more acid formation is there, the acid formation destroys your enamel, and everything happens during night time. So अभी से आप कितने बार ब्रश करोगे? कितने बार? 2 बार. Okay? हाँ. This is the simple thing what I told you. We are working for the nation, and in the beginning I told you to work for the nation. You need not go for the front line as a soldier. You can sit and do this work also. So whatever I am doing, you please help all the people to reach, to guide them properly as a dental health. Now, if you have any questions, you can ask me. I will try to answer them. Otherwise, no problem. Next time I will irritate you. Bye. If sir says any other lecture.
Surely, sir.
Acha. So I think so your time is not wasted. Whatever you paid me. Huh? Okay. If anybody has got some question, you are most welcome to ask me. I will try to answer them because I have got little literature along with me if you want. Otherwise, no problem. And if anybody wants to have any guidance, you can contact Dr. Variani sir. I can have their, I can help them in their dental consultation. And the people who are coming to me, you need not have to pay any consultation charges if you are coming to me. And if line of treatment is there, in that also, we'll try to adjust the things. Okay, sir.
Thanks a lot.